Hi guys, it's Dr. Charles Arndt here. I thought I'd tell you a few things today in this video, this short video. It's about the 3 causes of arthritis. Most people wonder where it comes from. They come into my office many times and they have problems going on. They say, I don't know how that has ever happened. Well, let me go over some of the causes first and we'll explain how that occurs and creates the arthritic situation. First of all, the first one is direct trauma. It seems pretty straightforward. A person gets hit in the shoulder, it hurts, it gets better, it feels like it's okay, but literally later on it doesn't heal properly. 2, a tracking problem. Tracking problems are actually much more common. People don't know this is going on. It's kind of like having the alignment off in the car and you don't know it's really happening, but the tires are wearing away. So you go to the garage, they say, hey, your tires are bad. Hey, we're just going to replace the tires. But it's really an alignment problem. There's different examples of that. A person could have a pelvic inequality, okay, where one leg is shorter than the other, putting more pressure on one knee or the hip or the ankle. There could be a problem in the feet where there's a pronation of the foot or some kind of problem in the foot that's leading to an imbalance that's causing arthritis in the knee or the hip. It could be a back problem that's causing pressure into the hips that's causing problems into the knees or the ankles or the hips. Any of those things can create problems. Those are tracking problems. The last one is actually nervous system problems, where the nerves that come from the spine, which is the only place they exit, is through those little holes between each vertebrae that go to the whole body, which can create a weakness in certain muscles and not other ones, which are creating imbalances on how the joint will actually operate. It's a different type of tracking problem. Some people have a combination of these different things, where they may have a tracking problem and they have direct trauma and it doesn't heal because of the problem with the tracking or the nervous system, in fact. Now, what does that do? Well, if we look at this, any of these problems lead to inflammation. And is inflammation good or bad? Well, inflammation can be very good because you're trying to put tissues in there to be able to heal the damaged area. But at the same time, it can lead to inflammatory products that lead to scar tissue. Now, what's wrong with scar tissue? Scar tissue can start forming around the joint that it prevents it from moving properly. Well, why is that bad? Because movement, there's no blood flow into a joint to get nutrients in or toxins out of that joint. You have to have movement of the joint to push pressure inside the joint and allow the nutrients to get in and out of that area. So if you look at this picture here, you can see this outside capsule around the bone. And you can see the bones are not touching each other. You can also see this area here underneath the bone, which is cartilage. That's also not touching. And you see there's a fluid. It's actually, you'll see it's in the blue. It's actually a fluid called synovial fluid. That's a hydraulic system. Those bones and cartilage never are touching each other. But you have all this capsule out here which is full of a blood supply. But how does that blood get in? It's with the movement of the joint. At pressure gradient changes allow the nutrients to get into that to feed the joint and also let the toxins expel out of it so it can actually heal. To summarize this, we have a whole process of different things that are causing inflammation and scar tissue, leading to a degenerative process because we're not getting nutrients inside the joint. So if anything I can share with you today, movement actually helps. When you move a joint and mobilize the joint over and over on a regular basis, you are now increasing nutrition to those tissues and will help prevent arthritis. Thanks, guys. We'll see you next time.